So I will just begin with some preliminary things to say. What we see in our research, and it's not only our research in Austria, it's the research worldwide, is that younger people have been affected psychologically by the pandemic more than other age groups. In the beginning, children have not been affected so much compared to the adolescents and young adults. But now children are getting worse and worse. So what we see now in the data is that also children are getting worse. If we just go to the next slide, please, Cecily. No, that's the first one. Yes, if we look at the younger people during the crisis, we see that they have the highest stress of all age groups. It's three areas mainly where we are concerned. It's sleep, it's eating, and it's movement. So rather basically, which is important for our interventions, especially the adolescents, they don't sleep at night. They have another biorhythms as other age groups, yes, we know. But now during the pandemic, this has worsened a lot. So many adolescents don't sleep anymore at night. They have disturbed eating behavior. You see how 70% disturbed eating behavior. The BMI of children and adolescents has gone up, high up, because they are not moving anymore. They are in front of the screen the whole day. They are not going out, they are not moving. So physical activity is one of the most important things that have to be done now. So it's also about physical. It's not in order to improve the psychological state. But what doesn't work with children and adolescents, as we all know, is that you just give them a program on the screen and they start to move. That's what we as adults do, but children don't do that. So we have to find other ways. If you go through these things, you see that they have 70% have an elevated stress level, 90% have health-related worries about the others. They have a high worry about their family members who are at risk. They are not worried about themselves, they are worried about the others. They have sleep disturbances, they have social isolation and feelings of loneliness. They, compared to the older age groups, they feel lonely. They are not only isolated, they feel lonely. The older age groups don't feel lonely. It's just mainly the younger ones. And they have the depressive thoughts. And what we see and what they also tell us from the children and youth psychiatry sector in Austria at the moment is that they have 12-year-olds after suicide attacks at the moment. Suicide attempts. So depressive and suicidal thoughts are on the rise. Give me the next slide, please, Cecily. Okay, so here you see the areas where they are affected at the moment. One area is the social context. So what we do at the moment, I'm in an advisory group for the health minister, and what we are really fighting for at the moment is opening safe spaces for children, safe spaces for social interaction, and safe spaces for movement. So you have to open up safe spaces. One of the things is, together with the epidemiologists, we as psychologists and psychiatrists have and other psychosocial professionals, we have developed a plan how to open up schools safely now and in the autumn, because we know that children will be in this pandemic much longer than adults. They will not be vaccinated so fast. So we will have this problem for the children 2 years, for example, or even longer, depending on what happens. So we have to have now not only a concept of closing and opening up all the time. This is not a good concept for the next years. The concept must be how to provide safe spaces for children and adolescents. That's a concept. And in these concepts, I think we as psychosocial people, we can play a very important role to, on the one hand, to think about how to provide these safe spaces, but also within these safe spaces to give the basic psychological support for the children. And I mean really basic. I don't mean psychological at all. I mean really, I mean movement, social interaction, the very, very, very basic things. I think Ea can talk a lot about that. The next space is the educational space. What we see here is that they are under a high pressure for academic achievement, because schools have not adapted really to the pandemic. What they did is they just had a focus on changing from face-to-face education to distance learning. But what they forgot is that children are staying at home and do homeschooling. If they are from a privileged family, they get much help from their parents. They learn a lot, and they go into the school only for exams. So what happens now is that many of these children, they get negative feedback. They do a lot, but they get feedback because the only thing that is that is evaluated at the moment is their exam achievement, yes, and nothing else. So what happens here is that this focus on academic achievement gets narrower and narrower. So what we are also fighting for is that schools start to give grades also for competencies and not only for academic achievement. So children have learned a lot during this year, but they don't get grades for that. They have achieved a lot. They have done a lot. But all the time we tell them, you didn't achieve anything, you have lost this year, you have to repeat. We don't give them any positive feedback for that. So, and that's really bad. Economic situation. Children are extremely affected by the economic situation of their parents. Unemployment in the parents, financial problems of the parents, missing financial security. More and more children are going into poverty. This is a really big problem. In the health sector, we see that children especially are worried about the health of their family and friends. And in the everyday life, we see that they are missing leisure activities. They are missing possibilities to meet friends, to sports, all the things that they normally can do. In Austria, for example, 2 weeks ago, we had an action in Vienna where they fined young adolescents for playing basketball, and each of them had to pay 100 euros, each of the basketball players. So and that's a feedback for young people that's not very good. And what we also see that in everyday life they experience many more conflicts at home, so they are more exposed to violence also at home and to conflicts at home. So that's the situation that we face now at the moment. So if you think about interventions, you have to think in all these areas. We need interventions in the area of poverty reducement, of real social and economic help, resources. We need help in the educational sector, help children to help children to reach the academic achievement that they have to reach, but on the other hand, help the system to change its focus on competencies. In social contact, to open up safe spaces in the health area, to give more information to children, to let them participate in the measures, because children from all age groups, children are the age group that is most active in keeping the measures. They are often seen as those who don't keep the measures, but that's not the truth. What we see in our data is that they are rather compliant, but they pay the highest price for the compliance. And so at the moment, they don't really follow the rules in the social contact area, because there the price gets too high for them. But what they do is they go testing. So they are very active in testing. They would do that. And that's why we have these concepts of testing, quarantine, and other social, non-pharmaceutical measures to help open up spaces in in school and also out of school. And in the everyday life, there has to be intervention in the violence prevention area, in the especially violence in the home, but also there has to be a lot to be done in the leisure activities. Open up sports places for children, open up spaces where they can be active, where they can move, and so on. And what we also see, and then I'm finished and give over to Silvia, what we also see is that especially for adolescents, they are in a disillusionment. They are easily disillusioned. And what happened to them is we compare our data from now to the data before the pandemic. And what we saw is that many adolescents, even before the pandemic, were very disillusioned. They had high stress levels because of the climate crisis. And what we have to do here is we have to let them participate in decisions, and we have to let them build up the future society together with the adults. So we have to involve them in all questions regarding health and climate and environment. So we have to combine the two topics, health and environment, and let them really participate. This would help a lot and give them back a little bit of their hope for the future. In our data, what we see is that the children or adolescents started with the feeling of anxiety and concern in the March, and now we see the feeling of powerlessness. They feel powerless. And so we have to do something against this feeling of powerlessness. Okay, Silvia has been has a lot of experience in the sector of psychosocial support, and also in the sector of the international department, because she has been with the SOS Children's Villages before. She has become a researcher at the university, medical university Innsbruck. She has done really extremely interesting research in India after the tsunami, and developed a resilience building program for children there, which was not easy to build up, but she did it in an excellent manner. And now she is back in Austria and in the child and adolescent psychiatry sector. And they do a really interesting study on children in Austria and Italy, and she will present her data now. I think, Cecily, you can give us the next slide. I think the next slide. Yes. Okay, Silvia.
Yeah, thank you. I start immediately. It's in Austria and Italy, but only a small part of Austria, a small part of Italy. It's in North and South Tyrol. Once they were one country, but a long time ago, but we still share some cultural heritage and also at least one language. This is the German language, but in South Tyrol, this is in Italy, they also speak Italian and Ladinish. However, there is our group of participants of our research, they come from this area. The next slide, please. Yeah, it's the main thing of our research, or the main research question is about how the children experience threat through COVID-19 and how it affects their mental health. Today, I'm just presenting a kind of sub-study or sub-data, but I already widened it a bit. And but the focus is on trauma symptoms, anxiety, and health-related quality of life. We have two points of view, or two perspectives from the children themselves. They are from 8 to 12 years, and also from the perspective of their parents, actually mothers, because 90% of the parents were mothers who participated in the study. So, and they estimate their children's mental health. Please, the next slide. Maybe I just say we had about 220 children answered our questions, and about 450 in the first survey, 450 parents answered, and in the second survey it was about 700 parents. And I start with the small children, with the young children in preschool age. It's about 3 to 6 years in Austria. The first survey was in March 2020. And maybe you know, Italy, they even had some very strong containment, some strong corona measures, and they closed already before the announcement of the World Health Organization, all on 12 March. Italy already on 5th March, they closed all health services. Children didn't go to school, they couldn't go outside. And we had, and the comparison of North and South Tyrol, we also had this lockdown in Austria, but not that also strong, but not that strong than in Italy or South Tyrol. And what we found afterwards, when we asked, when we compared the data of North and South Tyrolean children, we found that the South Tyrolean children, they withdrew much more than the preschool children in North Tyrol. Withdrawal means they showed less activity and interest in things. They did not get along as well with other children. They were more shy, more often sad. Yeah, they showed more this behavior, and after the quarantine, this trend continued, but not only among the younger children, but also among the older children. Maybe you know from yourself, when you are a long time not with a group, it's more difficult to come into this group again, to connect with the children or people again. And this was just a trend, what we found, that which tells us a bit about the effect of a very strong and long lockdown. The next slide, please. In the preschool children, we also had much more somatic complaints, and this withdrawing behavior in December 2020. This was our second service. We could see it again, and the somatic complaints have doubled. It was already in March when we at the first survey, and then in the second survey it has doubled. And this withdrawal behavior increased in girls and in boys, but it was really pronounced in boys. That they also showed this behavior, this less interest and less activity. Then the next slide. These are the children, these are the data on the 8-year, also on the school children. It's a child self-report on trauma symptoms. And we see the first lockdown in March 2020. This is the green area, also 100% of the data under this green area. And we see in March, during the first lockdown, 85% of the children said they are in the normal range. Something abnormal happened, and they showed some symptoms, but it was still in the normal range, normal reaction. And then this curve goes down, and we only have 9% in the distress range, where they are on the edge, on a turning point to really go to a clinical range of trauma symptomatic. But the blue curve, it's the lockdown in December 2020. This is very interesting. The curve is turning more to the right. That means more to a problematic range of trauma symptoms. And we have there two peaks. One peak is still at the at the normal range with 68%. Children think or say it's still okay, but then we have this increase from 9 to 16% in the distress range, and these are and we assume that these children with a next lockdown or a next measures, hard measures, they will probably move to the problematic, to the clinical range of trauma symptoms. We have an increase from 10%, from 6% during the first lockdown, and now 16%. Similar things we can see, thank you, with the anxiety. It's also a child self-report from these 8 to 12-year-old children. And it's not that clear here yet, but there is a tendency, a similar tendency, that it's moving to a problematic range, that the children, there's no cutoff score, but you see the blue curve, the second lockdown in December, it's more anxiety, more helplessness, and more worries. The children tell about more worries. In comparison, we will see the estimation or the assessment of their parents. This would be the next slide, please. This is anxious, depressed, the parental report on that. We also have 95% were at the normal range during the first lockdown. This is the green curve. And at the second lockdown, it was okay, 90%. Still, it's not that obvious then with the trauma symptoms, but it's also going in this direction, more anxiety and more worries. And also in the clinical range, the parents estimated the data doubled from 5 to 10%. And then the next slide, please. It's the health-related quality of life. And I think this is a really interesting slide because it tells us also a lot about the girls and the boys. We have here the self-estimation, the self-report of the children. It's the full triangle and the full dot. And if we just asked the children, we just asked twice at March 2020 and in December 2020. And what we can see here is that the quality of life is rather low in March, and it increases a bit, but not much in December, because these are the two lockdown times. Here is interesting, the parents. Number one is interesting. The parents are they're not the full triangle and not the full dot. They assess their girls, the mothers assess their daughters, that they have much a better quality of life than their sons. So there is a gap. They think the daughters are doing much better than their sons. But as you can see at the children's estimation, they don't make a difference. Boys and girls don't make a difference. They speak about similar quality.
Silvia, sorry to interrupt you.
Yeah.
But we only have 2 or 3 minutes left.
Okay. Yeah, but I'm finished soon.
Yes, I know.
In 2 minutes or 3 minutes, I'm finished. And in June, we see that the parents think the quality of life is better of the children, and we know that it's because they could see their friends again. 53% that there is an increase of quality of life was because they see their friends again. And in December, this is interesting because of the gender. In December, parents estimate their daughters and sons in a similar way. There's not this gap then in the March that they think daughters are doing better. Next slide, please. Actually, we don't. And next slide, we don't need it, maybe. And the next that we go straight to the conclusion. I think, or we think, the results are somehow alarming, that there is a group of vulnerable children who are in this distress zone, and with new measures, and they probably will move to the clinical range. And we also think that we are at a turning point, in with a possible direction in deterioration of children's mental health. And it's really time to promote resilience at the children's, at the individual level, but also at the society level. For example, as Barbara already said, this building of safe spaces. And now I'm at the end.